Dr. Chavez Haneko's presentation today will be invisible in the time of COVID-19, what we all can do to help the Latino communities. And I think it's particularly relevant. We started planning this about 3 weeks ago. And I think it highlights the importance of being able to engage, to understand, and to support those who are perhaps less fortunate and present than so many of us. Without further ado, let me introduce to you Dr. Diego Chavez Hanako.
Thank you very much, Manuel. So I want to thank Manuel and the Center for Latin American Studies, all the faculty, the staff, Jessica, Luis, for having me. It is an honor to be able to share these ideas with you. And more than a formal presentation, this will be a discussion about kind of brainstorm about how can we help our own community. I'll be giving a formal presentation for the first 30 or 40 minutes, and then we'll have a conversation about how can we help our communities. So as Manuel said, I'm a developmental behavioral pediatrician. I'm an associate professor with the University of Pittsburgh School of Medicine, and I'm also very proud of being an associate faculty with the Center for Latin American Studies. So the reason for this, for the name of this talk is based on the book of the Nobel Prize Garcia Marquez, who happened also to be from Colombia, Love in the Time of Cholera. This is one of my favorite books. If you haven't read it, I highly recommend it. It talks about another pandemic, the pandemic of cholera. And one of the characters actually happened to be a physician. While it's not one of the main principal characters, it does involve all the measures that they were doing around the time of this pandemic in Cartagena, Colombia. And of course, it's a love novel. So I highly encourage you to read this book if you have not. It's a beautiful book that describes a lot of the things from Cartagena. If you have been in Cartagena and you read this book, it will bring you back to Cartagena. If you have not, if you ever visit Cartagena, I highly encourage you to read this book before you visit Cartagena. So there are one or two videos that I'm going to encourage everybody to watch, and we're going to ask them to watch at a later time. If we were going to share it to Zoom, there might be some technical problems. So I don't want to spend time on that, but as Manuel mentioned, these slides are going to be available to watch at a later time, the presentation entirely. So one of the things that you guys can do is go back to this link, which is basically a news clip from CBS. It was presented about a month ago, and it talks about Latino communities being hit hard by coronavirus. And it's a very short piece, it's about 2 minutes, but what it caught my attention the most from this presentation is the final words of the presentation that are given by a community leader in Chicago. And the way that the video ends is with the following words. The community leader is being asked why this should matter to everybody, why this should be important for the entire community. And as a matter of fact, more particular, they're asking about whether we should take into consideration that maybe some of the members of the Latino communities are undocumented or not. And his answer is very clear and very pertinent to what we're talking today. And I'm going to read it to you. This is a wartime situation. You're not going to make anyone safer by having any portion of the population sick, because you're going to be sick. So bottom line, whether we are Latinos or not, we should take care of everybody in our communities, Latinos or not Latinos. And while we might have some privileged conditions, the fact that we are part of the human race, the human beings, it put us at risk by the fact that there might be some segments of the population who are at higher risk. So this is true for Latino communities, this is true for African American communities, and actually that gives relevance to the presentation that we're going to have today. So some of the aims of this presentation, we're going to review demographic characteristics of Latinos in the United States, in Pennsylvania and in Southwestern Pennsylvania. We're going to review some epidemiological characteristics of COVID-19 in Latinos. We're going to learn why Latinos are especially vulnerable to COVID-19. And we're going to learn what academia and in general community members can do to support and help the Latino community through advocacy and through some community resources. So this slide is from the census, the US Census. As many of you know, we're encouraging everybody to answer the 2020 census. The census is done every 10 years. And actually these numbers are some estimations. There is something that is done between every 10-year census, which is the American Community Survey. So They do estimations based on previous census. They also use phone surveys. And the 2018 American Community Survey tells us that we're close to 60 million of Latinos in the US and about 18% of the population. The other thing that I like to point out when I show this slide is something that is pertinent to my job. I'm a pediatrician, I work with children, and is that in general, the Latino community tends to be a younger community than the mainstream community. So here you have ages in the y-axis, and then the percentage of the population in the x-axis. And as you can see, the mainstream population, you have this increase in the population, which are the baby boomers. And right now they're close to the age of 60 and maybe above. While the Latino population, the majority tend to be a younger population under the age of 18. So 1/3 of the Latino population is under the age of 18. Well, only 1/4 of the main population is under the age of 18. If we look at areas like Southwestern Pennsylvania, Allegheny County, I will say that this is even lower, not only 1/4, but maybe 1/5. This is in some ways good news because we know COVID-19 and coronavirus has higher risk for the segment of the population who is above the age of 50 and 60. But in the other hand, that's not the only risk factor. And actually, in a few slides, we're going to be talking about other risk factors. So while we're a young population, a young community, we do have other risk factors for COVID-19. The other thing that I wonder if anybody in the audience is wondering about this is why Latino population tend to be younger compared to the mainstream population. And it has to do with the fact that, people tend to migrate when they're younger, not necessarily when they're older. And also because natality rates, birth rates are higher in our community. Okay, so a few words about Latinos in the US. The majority are citizens. The majority are children that are born in this country. The majority are second and third generation, meaning that their parents or their grandparents were the ones who migrated for the first time. While the majority speak Spanish, also a large proportion of them also, or us, also we speak English. And then the majority of Latinos 25 years and older has at least a high school degree. So education is a big problem in our communities, and there are some disparities in terms of education. But as you look at these numbers about high school, these are important numbers, and there is definitely some improvements when compared to previous decades. Half of the Latinos in the United States are homeowners, and then 19.5 million vote in the last election, and I'm not talking about yesterday's election, but in the general election. And then 25 million will be eligible to vote in November. So I make a pitch for everybody to answer the census a few slides ago. I also want to make a pitch for everybody who is eligible to vote to please vote in November. We're talking about how can we help our communities. This is one of them. Please vote. Now let's talk about Latinos in Pennsylvania. I particularly like this slide because it highlights one of the important concept, which is the difference between race and ethnicity. So ethnicity talks about a group that shares same cultural traits, same language. This is Latinos. And race talks about different characteristics. And here you can see that you can be Latino and white, or you can be Latino and African American, you can be Latino and Asian. And these are the numbers for the state of Pennsylvania. So in Pennsylvania, we are close to 1 million Latinos, and we represent 7.6% of the total population in the state of Pennsylvania. And again, this is based on the 2018 American Community Survey. Now, I also think that it's very interesting if you think about this slide that many of you have seen for the last couple of months, the daily briefings that the governor and our health department secretary does, or they do on a daily basis. And when you see these press releases, you see that they do it by using somebody who's doing sign language simultaneously. Well, the population in Pennsylvania who's hearing impaired is anywhere between 6 to 8%. So the percentage is very similar to the Latino population in the state of Pennsylvania. However, and we have requested this to happen, and we have asked in many ways to the state to accommodate, but we still don't see these press releases, we don't see these briefings with simultaneous interpretation into Spanish or with closed caption titles in Spanish. So that's definitely an issue, and we're gonna be talking about how can we help the Latino community by improving and increasing the access to information that is appropriate, that is easily reachable, and that is in Spanish. As a matter of fact, about a month ago, we did a presentation with Casa San Jose in Spanish for the community, talking about COVID-19 and how to protect the community and how to protect individuals. This is not the objective for this presentation, but that's one of the things that we have done to help the community. So we're trying to start working to make sure that resources are available in Spanish for the community. Things has improved, I have to say. When the pandemic started back in March, if you happen to visit the website of the Department of Health and the state of Pennsylvania, the governor's office, it was very interesting because they were using a very poor system of translation. And for those of you who speak Spanish will clearly understand this. The word in Spanish for the wolf animal and the word for the last name wolf is exactly the same. So the software that they were using initially were translating that el gobernador lobo. So they were translating like governor and then the word as the animal noun without making that much sense. Fortunately, they changed that. Now they have a better interpretation service for their website, and now it clearly states in Spanish el gobernador wolf. So there have been some improvement over the recent weeks, over the recent months, but still there is so much that we can still do better. In particular, this thing that I was mentioning in terms of simultaneous interpretation for briefing, press releases in Spanish with closed caption. And this is true for the state, and this is true for the local level, for the county, and all the counties in Southwestern Pennsylvania. Now, a lot of these things change on a daily basis. And one of the problems that we have had, and I'm going to refer to this again in a few slides, is the fact that we don't have a good count about members in our community, members of the Latino community who are experiencing the symptoms or the diagnosis of COVID-19. And the reason why we are struggling with this is because there is not a good way to track this testing, the testing that they are doing, or the admission to the hospital. I have had conversations with the Allegheny County Health Commissioner about this. They're working on this, but it's not perfect. And things change on a daily basis. So up until about 2 weeks ago, the CDC didn't have anything about ethnicity. About 2 weeks ago, some data was starting to show up, and they actually put disclaimers about that they don't have all the data for all the cases in terms of ethnicity. So here, this is a slide that it was available up until about 3 or 4 days ago on the CDC website. And at that time, they were telling us that 30.1% of the cases were Latinos, while 69.9% were non-Latinos. And that was on a data collected of close to 1.5 million people, with ethnicity only being available for 657,000 of this testing or this sample. So that was definitely a limitation. It's improving, it's changing on a day-by-day basis. This specific slide is no longer available on the CDC, and actually, this morning I was looking about what they are posting today, and what they have switched is a very interesting model that I'm not sure that is better or not, but I'm going to share it with you guys. Basically, what they have now is they have a mix between race and ethnicity. So now they're showing the number of cases, for example, for American Indian, Alaska Native, I'm pointing to here, the 1.2% who are non-Latinos, Asian non-Latinos, 4.2%, African Americans non-Latino, 22.3%. And then you have Latinos, which is 32.6%. In the previous slide, I was talking about 31%. Now it's 32.6%. Regardless, if you think about it, I mentioned earlier that in the United States, we are only 18% of the population. And yet, we have overrepresentation in the number of cases, close to 32% of the cases. So this is evidence how hard this pandemic has hit at our community and members of our community. And again, this is something that is available on the website from the CDC today, where they are mixing race and ethnicity. So we're thinking that, you know, if you're Black or African American, but yet you are Latino, you would be in these numbers. And of course, the numbers are higher in that regard. I'm not sure if it's better or not to have the mix between races and ethnicity, but that's how they're presenting it right now. And again, they're giving the disclaimer that it's not on everybody that they have the information about ethnicity or race. Okay, so we just talked about the United States. Let's talk about Pennsylvania. So Pennsylvania, up until this morning, I checked in the website this morning, had nothing on their website about ethnicity. However, they are releasing this weekly report, and I believe it was the first report 2 weeks ago, dated May 22nd, that for the first time they were showing ethnicity. This is from last Friday, where they start showing ethnicity, and it's a weekly report that they sent. And in that report, they were talking about the presence of COVID-19 on the Hispanic population, and the numbers were not that high, and the percentage was not that high, but still, I think it's an improvement to start to disclose some of the data. We have been making a big effort to make sure that the authorities at many levels, at the local level, at the county level, at the state level, disclose most of this information because that's part of our invisibility. We're invisible because people don't know that we exist. When I came 20 years ago to Pittsburgh, 22 years ago to Pittsburgh, I heard that there were no Latinos in Southwestern Pennsylvania, and I'm looking right now. Last time that I saw, we were 66 in this presentation, and who knows how many of us are Latinos. I'll show you some specific demographics about our area, but certainly there is a lot of us in this area, so we do exist. And then the second point is, it's very clearly to jump into a conclusion, well, there is no COVID in Latinos if we're not counting it. And that's part of the invisibility. Unless we start counting ourselves in general through a census or other means, and unless we start counting how many of the members of our community are experiencing this condition, otherwise we're not going to be able to realize the specific numbers, and we're going to continue to be invisible. And if we're invisible, we cannot address the needs of our community. I will have to make an exception with the state of Pennsylvania, and that is Philadelphia. Philadelphia, since early days of the pandemic, started to release information about the Latino population. And this is actually current in the website of the city of Philadelphia from the health department. And every day at 1 p.m., they update this presentation. So this demographic. So today at 1 p.m., they developed this, and it's about 9.4% of the population of Philadelphia are reporting cases with COVID-19. It's a significant number. I don't have the specific demographics in general for the community of Philadelphia. But again, if you think about it, if we compare this to the state is 7.2%. This is a very high number. I'm not sure if it's truly overrepresentation, but still, it's a very significant number. Okay, so Latinos and COVID-19. So kind of with the previous numbers, I have shown you how we are at high risk of contracting COVID-19. This is true because of many characteristics that I'm going to explain in a minute, but it also has to do with what we call social determinants. So social determinants are things related to, for example, socio-economic status, employment. We're going to be talking about those in a minute. And also we're going to talk about how Latinos and our community is not a high risk for the condition of COVID-19, but also a higher risk for conditions that are called social determinants, such as food insecurity, unemployment, etc. There is also not only a higher number of cases in the Latino community for COVID-19, but a higher mortality in the Latino communities. So kind of to summarize what I have been shown with previous slides, 18% of the population in the United States is Latinos, but 27% of all COVID-19 deaths have been attributed to our community. So definitely our representation. And there are places and there are cities and states that have been doing a much better job than Pennsylvania and Allegheny County and Pittsburgh in terms of reporting this. And one of those examples is New York City. In New York City, the Latino population is 29%. 39% of all the deaths in New York City are in Latinos. So definitely our representation, unfortunately, in our community. So why this happened? And the reason is, there are many reasons why we are at high risk for COVID-19. One is because our communities, members of our communities tend to have in higher numbers essential jobs. So there is a lot of people who work in healthcare. There are doctors, there are medical assistants, there are nurses, pharmacists. So a lot of people working in essential works in healthcare, but that's not the only type of jobs that members of our community hold. So many people who work in the service industry, many people who work in food services, in restaurants, many people who work in food packing plants. As a matter of fact, there are some local food packing plants in our area in Southwestern Pennsylvania. People who work in construction, those are workers that are considered being essential, and because they're essential, they have a lower possibility to work from home, and therefore, by having a lower possibility to work from home, they have a higher chance for social contacting and a higher risk for contracting the condition. Only 49% of Latinos have health insurance, and this is a huge problem. And this is another place where I can ask for your advocacy. So I will tell you, we run a free clinic. For those of you who don't know, we have the program Salud para Niños, and we have a free clinic that will provide healthcare for children who don't have health insurance. 2019 was the year in record, in 18 years that we have been doing this, and that we have the highest numbers in our free clinic, the higher numbers of uninsured kids that we saw. And there are many reasons for this. Unfortunately, over the last 4 years, many people have lost insurance. Many people have chosen not to apply for insurance because of concerns about their immigration implications. Bottom line, we're seeing more and more people who are uninsured. We knew this before this pandemic. And as a matter of fact, these numbers were being reported that the number of uninsured people in the United States, not only Latinos, but in general, the number of uninsured people in the United States was increasing. And the response from the federal government was that the numbers were showing like that is because more people were getting jobs, unemployment was going lower, and therefore people were getting insurance through their employers. And we know that that's not true. We see that a lot of people are dropping their medical assistance, the state health-based insurance, and actually they are not choosing to either re-enroll or they no longer can afford to pay for these insurances. So bottom line, we're seeing more and more people without health insurance. Not having health insurance is a big problem because if you don't have health insurance, then you don't have healthcare access. If you don't have healthcare access, you don't have access to preventive care that are going to prevent some of the conditions that put you at risk for COVID-19. And some of those conditions include things such as diabetes and obesity. The Latino population and Latinos in general in the United States have higher risk than the general population to have conditions such as diabetes and obesity. And this is something that we all need to work very careful in our communities, in our families, in individual basis. We need to do everything that we can do to avoid obesity in our communities, to avoid diabetes in our communities. Our numbers are as concerning as the numbers of Native Americans tribes. I have here about the Navajo tribe, and they're actually having high problems with COVID-19 because of similar reasons. We also have higher risk for social contacting, and it has to do with our cultural practices and also the way that we live, and we're going to be talking about that in a minute. And finally, while the risk for cardiovascular conditions and hypertension might not be higher in the Latino population, although somebody can argue that diabetes and obesity put you at high risk for cardiovascular condition and hypertension, what we know for sure is that when Latinos have cardiovascular conditions and hypertension, they tend to have these conditions poor control due to a lack of healthcare access or lack of insurance. And of course, if these conditions are not controlled, you're at higher risk to having COVID-19 and having sequelas, severe sequelas, morbidity, mortality with COVID-19. That's what it has shown as the data from people who have been hospitalized and the data from mortality, people who have gone to the ICU unit, ventilators. They usually had these risk factors: diabetes, obesity, hypertension, cardiovascular conditions. Okay. So more words about Latino characteristics of the Latino community. You guys have heard this on the news all the time. Unemployment rates are skyrocketing. The latest that I hear was close to 20%. When I checked these last numbers for the general population was around 14.7%, and for Latino population was 19%. So we're probably 5 points above, 4 to 5 points above whatever the unemployment rate is. So if they're talking that now the unemployment rate could be 20%, maybe in the Latino population could be as high as 24, 25%. So definitely really high. 1 in 4, 1 in 5 Latinos might not currently have a job, and it's really, really high. And it's also really high in the way that Latinos don't qualify for things such as unemployment insurance, and we're going to talk about that. We did talk about the higher numbers of jobs in service industry, hospitality, office, farming, etc. There are some difficult situations in rural areas of our state. This is in the middle part of the state, Chambersburg, Franklin County, Pennsylvania, but also that happened as well here in Southwestern Pennsylvania. And I have mentioned before the lack of information about COVID-19, and that has to do with the lack of media in Spanish, the lack of trusted information that reach our communities. We have tried to work on that by the webinar that we did in Spanish a few weeks ago with Casa San Jose and with UPMC. But the more that we can do in order to provide reliable and trusted information, the better. If you go into social media, you will see that there is a lot of misinformation, a lot of misguidance about how you can prevent COVID or where is the origin of COVID and things like that. And that's a problem. And also, there is not appropriate and well-guided information that will help the families to be safe and to be healthy. Now, the next couple of quotes were made by Veronica Escobar, who's a Texas representative member of the Congressional Hispanic Caucus. She's in San Antonio. And when she was talking about this, she was saying that this is something that Dr. Anthony Fauci, director of the Institute of Allergy and Immunology at the NIH, mentioned to her. And basically, he was telling her that the Latino community should be treated the same way that other vulnerable communities are being treated, comparable to nursing homes and people who live in assisted living facilities. And that includes testing and tracing of minority communities. So that's what has been recommended. And as many of you know, up until recently, we were having problems of having more available testing. The good news is that this is improving, that this is getting better. And as a matter of fact, last week, there were some testing being done in some target areas, in some particular neighborhoods of our community, Beachview, Brookline, Northside. So now it's much, much easier to get a test, even without a doctor's order. They're asking people if you want to have the test, just walk in, and there are many sites. And if anybody's interested in this, just go to the website of the Allegheny County Health Department, achd.net, and you will see where you can get tested. And there are many places where you can be tested for COVID-19, and you don't need a doctor's order, you can just walk in. And then finally, we put a lot of emphasis in increasing availability of information. I mentioned this already, and advocacy. And there are many things that you can do in advocacy, things that you can do at the personal levels, things that encourage everybody to do, such as answer the census, make sure you vote, make sure that if you can support it's called the Dream Care. And Dream Care is the making sure that all kids in Pennsylvania, regardless of immigration status, have health insurance. So we can support that initiative that is being run at the state level. That would be great. And any other ways that you can advocate for our community better. The idea is that we speak for those who don't have a voice. And a lot of members in our community usually don't have a voice. And those of us who have a voice, we should make sure that we are being heard. Now, moving forward, this is from the Migration Policy Institute, and I want to make the note that all these numbers count for immigrants, and not all Latinos are represented here, and not all immigrants are Latinos. But basically, they are talking about the effects of the Stimulus Act, the CARE Act, and basically 15.4 million of people didn't receive this stimulus payment because they are in what they call mixed status families. So families who maybe one of the members is not a U.S. citizen or didn't meet the criteria. So for example, 9.9 million of unauthorized immigrants wouldn't qualify for this stimulus package. 3.7 million of children that, despite the fact that they are U.S. citizens or green card holders, they wouldn't qualify because of the immigration status of their parents. 1.7 million of spouses that, while being U.S. citizens, because of their husband not being U.S. citizens, they wouldn't qualify. In total, 5.5 million of U.S. citizens and green card holders were excluded from this relief because of this status of being in mixed families. So a lot of people didn't benefit from the Incentive Care Act. And also, a lot of our members in our community won't qualify for unemployment insurance. And that's a big problem because these are people who are going for months now without receiving any type of payment, any type of salary, any type of financial support, at least from the federal government. I'm going to share with you guys in a few minutes some things that are being done at the local level. It's not a lot, but it's something that is helping families and community members. This is from the Brigham and Women's Hospital in Boston. And I really like that they label it with the way that it is. They are talking about here about racial disparities. And among racial disparities, they talk about exposure risk at work, that I mentioned why, exposure risk in public transportation. So a lot of the members in our community rely on public transportation, public transit, and we know that as we have problems with exposure at risk at work, exposure in public transportation, exposure with shared living spaces. And this is huge because we in the medical community sometimes give advice about, oh, well, if somebody in the family is being diagnosed with COVID, or if somebody in the family is suspected to have COVID, what you need to do is to isolate that member of the family in one room. And while it's so easy to say that, we know that this is not necessarily possible in many of our vulnerable minority communities, not only Latino communities, but sometimes African-American communities and other less privileged. So many of the members of our communities live in big family groups that they only share a room. That's it, only one room for everybody. And there is no way to isolate somebody in another room because that's all what they have. And the same thing with the bathroom, they only have one bathroom. We did talk about comorbid health conditions, access to healthcare and testing. I really like that the Brigham and Women's Hospital in Boston actually named it with something that is racism in healthcare delivery. And then they talk about chronic stress. And in pediatrics, we talk about another concept that is called toxic stress. If you had been exposed to some kind of toxic stress, some kind of stressful situation socially, that might actually affect in kids their development, but also might affect your response, for example, your immune response to different conditions. So just to give some examples, immigrants, sometimes their process of immigration into this country is a very traumatic process, or they are immigrating because they have been victims of violence or displacement, or they come as refugees, or actually family members who are victims of domestic violence or abuse, or even in the case of Puerto Ricans, that while they are citizens, they have come to the States and to the main continent and to Pennsylvania and to Pittsburgh, running from other stressful situations such as Hurricane Maria, such as the earthquake. So many members in our community have experienced chronic stress, toxic stress that actually also make them more vulnerable for this kind of condition, this kind of pandemic. How can we help these families? So when I was talking to my colleagues, the pediatricians, I was telling them the importance of collecting transparent data in terms of age, sex, race, ethnicity, primary language, and socioeconomic status. And if we cannot collect that information with the socioeconomic status, at least a proxy by zip code. I know that sometimes zip code can be used as a proxy for socioeconomic status, but the more that we can do to track and to make visible our community, the better. So at the beginning of this presentation, I was talking about the problems with testing and reporting COVID-19 in the Latino community. This is a way that we can help our communities by making better the way that we're tracking the cases in our community. Just by doing that, it's a big improvement. I also talk about social determinants of health and screening for social determinants of health. And I will tell you, in pediatrician's office and in our practice, it's very common, and this is something that the American Academy of Pediatrics is supporting, to screen for the needs of the members of the family, for the needs of the member of the community. So it's not uncommon that somebody comes with their kid because the child may have an ear infection or need their vaccinations or need just a regular checkup. But we're asking more and more these days, and even before the pandemic, is everybody able to eat? Do you have enough food at home? Does everybody has a job? Do you need help? And actually, we try to help as much as we can. As for example, in our office, in our clinic, we have a partnership with the food bank, and we have some food boxes of non-perishable items that we can provide to families if they need it. Obviously, it's not that much, and it's more for like an emergency. And the idea is that they should help this non-perishable foods should help while making the bridge to some more stable resources, like more stable resources from the food bank and others that I'm going to mention in a minute. The other thing that we're encouraging is that when people don't speak the second language, to use appropriate ways to communicate with families. So the use of interpretation services, the use of certified interpreters, that definitely will help. And I mentioned before how we would like to see the media and then the press releases made by the governor and by the county with Spanish with closed caption. Develop communication tools for patients with disabilities. I was very interested about this because it was mentioned by the Harvard Birmingham and Women Hospital, but I also thought that this was important for us who have English as a second language. So many years ago, actually in class, I was listening to this presentation about how students who have English as a second language tend to read lips. And while here they're advocating for use of clear masks for people with disabilities who are doing definitely lip reading, I was thinking that having clear masks, face masks with clear windows, will help people who have English as a second language, because without realizing it, many of us tend to read lips, and we do it, and this will help with communication. In our clinic, we have photos of our team in the waiting room, and we try to involve diverse personnel. So in our clinic, we have people from many countries of Latin America. We try that to make that connection in terms of culture and language with our patients. So what can we tell the community? I've been talking about the importance of conveying an appropriate message for the community. So really important that we recommend to avoid physical contact. It's not about avoiding social distancing, social contact. You know, right now we're having social contact through this media, to Zoom. We want people to still being connected. Connected is really important. Having community connection is really important. But yet it is really important that we have that physical distancing, in particular the 6 feet apart, the 2 meters distance. You know, on Friday, we're going to be going to Green in Allegheny County and in other surrounding counties. This is not like a green light to back to what we used to do 6 months ago, but it's a reminder to maintain that physical distancing when we go to the stores, when we go to work. Really, really important that we remind this for people. And we recommend, in particular, because this is very common in our culture, some demonstrations or caring and love and physical interaction. So we're so used to handshaking, hugs, kisses. Just last week, I had somebody from the community that I was seeing, and he right away went to shake my hand. And, you know, in other days I would have hesitated, but now, you know, I had to remind him we no longer do this, unfortunately. And who knows when we might be able to do that again. But really important, we remind ourselves and that we remind members in our community that handshaking, hugging, kissing is not the best during the current time. We want to recommend to avoid social and physical events. Even if we move to the green phase, there are some indications from the governor in the way that this should be done. And when we were in the red phase and in the yellow phase, definitely to discourage events such as quinceañeras, graduations, anniversaries. What I saw in the community is that people were okay maintaining the quarantine at home, staying at home, physical distance, etc. But when it came to this particular events, for some reason, people thought that it was okay to make exceptions. And we saw pictures in social media of people celebrating parties, people celebrating quinceañeras, and unfortunately, that's not the best thing that we can do at this time. So we need to remind members in our community to please avoid doing the celebrations. Is not canceling the celebration, is not avoiding the celebration, is just postponing the celebration. And in the meantime, finding other ways to celebrate, maybe virtually. We want to recommend to avoid physical contact with family members. That's another thing. We have seen in our community that people are okay of maybe maintaining that physical distancing, but they tend to make exceptions with family members. And family members shouldn't be an exception. If the family members don't live in the same household, we should try to maintain that physical distancing and avoid it. So I had a family who was telling me, well, we got together with my family. They are family. Yeah, but where do they live? Oh, they live close by. Well, what is close by? 15 minutes away. That shouldn't happen. That's not a good idea. And same thing with traveling. For some reason, people thought in our community that traveling was okay. And we have a lot of people in our community who have members who live in the state of New York, or in the state of Maryland, or in Florida, or in California, and they're traveling. And actually, that's the way that the virus has been transmitted throughout the country, by traveling. We know that the virus came to the United States from other countries, from China, from France, from Spain. And we know that the virus came to the state of Pennsylvania from other states. So we need to avoid and discourage travel as much as we can. Similar to what I was mentioning before in terms of social gatherings, for some reason, religious gatherings became an exception. And right now, different religious congregations have different guidelines. And, they're doing celebrations in parking lots, in open air. They have different guidelines. We need to try to stay with those guidelines. And we as Latinos, we love to, go for lunch or go for dinner after that we attended mass. This is another thing that we need to think twice under the current circumstances. When we need to recommend that somebody's isolated at home, also take into account special considerations that people might only have a single room for the entire family. And if that's the case, what we need to do is try to isolate as much as we can in a special area of this room. So just having that person using that specific corner of the room, and then kind of isolate what we can isolate. So if we can isolate the bathroom, great. If we have two bathrooms, having one bathroom for the person who's sick and the other bathroom for the ones who are not. If we only have one bathroom, we need to do frequent cleaning after that person that we are concerned of tested positive use the bathroom. That way it's not transmitted among the members of the family. We need to isolate beds and bathroom clothes. That's an easy way to do it. No sharing bed, no sharing clothes. And then to isolate plates and utensils, that's another way to isolate that person that I might be practical. A few words about Latinos in Southwestern Pennsylvania. This is the city of Pittsburgh. Many of you have seen this slide before. In the brown circles we have where members of our community are. While there are some neighborhoods that is growing the most, the community, Beachview, Brookline, we know because of the patients that we see that everybody, Latinos are all over around our area. And in blue, we have the areas where we provide services in Oakland, in Lawrenceville, and in the South Side. Some unique characteristics of our community has to do with the lack of barrio and neighborhood, although I just mentioned that Beachview, Brookline, some of the areas that are increasing, disproportion between education and income, and as well as country of origin. Up until 2000, the majority of Latinos in Southwestern Pennsylvania were South and Central Americans. By 2010, the majority were Mexican Americans. We're looking forward to see what the census of 2020 shows us. We know that there has been a huge increase in the Puerto Rican community, but it's a mix. And what is interesting from Southwestern Pennsylvania is that it's very different to Central Pennsylvania and to Philadelphia, where the majority for sure are Puerto Ricans. Okay. Some other words about Southwestern Pennsylvania. There has been a steady increase in our population compared to the general population. The general population for many years was going in the opposite direction, going down, or in the best case scenario, not changing. Our population, the Latino population in Southwestern Pennsylvania in the 7 counties has continued increasing. And the latest number for the population survey tell us that we are close to 42,000 Latinos in Southwestern Pennsylvania, and 1/3 of them, close to 12,000, under the age of 8. Now, there are some places where families can get, members of our community can get reliable information. So the Center for Disease Control, the CDC, has a 1-800 number, and they have an option in Spanish that is available. The county has this phone number that is also available with interpretation services. 211 is a really good resource, and they actually have 1-800 numbers for each county, and that's something that we're also promoting. And we're also promoting the use of our clinic, where we have an option 8 for people who speak only Spanish, and they can talk to us about their health of their children. For people who are having food insecurities, a couple of initiatives. You guys have heard about the Pittsburgh Polka Schools. They have the grab and go meals, and the information is available on the website. We have the Greater Community Food Bank, food pantries. They also have the website there. Not sure how many of you guys know about the WIC program, but WIC stands for Women, Infant, and Children. This is a service that is from the federal government, and it's managed by the counties. So Allegheny County has the WIC office, and they provide food support for families who have children under the age of 5 or women who are pregnant. And this is a service that about 50% of the population rely on. And unfortunately, because of the pandemic, some of the offices were closed or were operating modified schedule. So what we encourage is everybody to call before they go to see whether their office is open or whether they need to go to a different office than the one that they usually use. Perhaps one of the most important things from this presentation is what we have available in terms of community resources. Many of you might know about this, many of you don't, but I want to make a big pitch for Casa San Jose, for the Latino Family Center, for the Latino Community Center. They're doing an amazing job. And then I'm going to share some of the things that they have been doing. Again, I'm not going to spend time on the videos, but this is a video from Casa San Jose. And in this video, they're showing what they're doing. So Casa San Jose was able to get some donations, and they were able to provide a specific financial support for families. It was not the $1,200 that the federal government was providing to all families, but it was some cash money that they have been giving to families. And if you look at this video, you will see how families come to Casa San Jose, and they have different stations where they will get food from the food bank, where they will get different flyers about how to protect themselves from COVID-19, the use of masks. They will get information about the census. They will get information about other social services, prevention of domestic violence, etc. And then they will get a cash or a check that will help them. It's not a lot of money, but it's something. And a big applause for what Casa San Jose is doing, because they have been doing a great job on a daily basis. They also had this initiative that I thought it was very interesting. I participated with them in this, and it's basically to support our local restaurants. And I also want to make a big pitch about this. I mentioned before that I came to Pittsburgh 22 years ago. When I first came to Pittsburgh in 1998, there was only one Mexican restaurant in Monrovia. That was it. And we made a big deal about going for lunch after Mass on Sundays. Now we're so lucky that we have such a diverse possibility of restaurants in our area. We have Peruvian restaurant, we have Colombian restaurant, we have Venezuelan restaurant, we have Dominican restaurants, we have Argentinian restaurants. We are probably missing more Puerto Rican restaurants, Cuban restaurants, but the options are much more. And the majority of these businesses are small businesses owned by members of the community. So with some monetary donation made to Casa San Jose purchased food in these restaurants to distribute to the community. And this is great because through this way, not only we're supporting the local businesses, the local restaurants, but we're also feeding the people who need it the most. It's not a lot, it's not equivalent to providing groceries, but it definitely helps, and it helps our restaurants. And obviously we want these restaurants to survive this pandemic. Some other resources available. We know that in this time of crisis, domestic violence is a problem, child abuse is a problem. So there is the phone number from the Women's Shelter of Pittsburgh. They have an option in Spanish, option 3. Pittsburgh Action Against Rape. They also have an option in Spanish. They have therapists in Spanish. The information is there. And then for people who are experiencing a crisis, mental health crisis, depression, anxiety, as a matter of fact, we all are. They talk about the second epidemic, which is not COVID, but it's mental health. We have the option of using the Resolve Crisis phone number, 1-888-7-YOU-CAN, 24/7. They have interpreters available, and this is free, and anybody can use it, and it's a very good resource. And with that, I'm going to stop. I'm sorry, run over time, but I think we still have some minutes for questions and answers. And I welcome any questions, any thoughts in ways that we can help our communities. Thank you very much.
Thank you, Diego. That was great. And you did go through a lot of information in a very short period of time. I hope that everybody was able to watch the whole presentation from beginning to end. There are a couple of questions that surfaced during the presentation, and I wanted to start with one of them, which related to the methods. This is from Felicia Alexander, who requested or asked, how do you screen for socioeconomic determinants?
So kind of what I was mentioning before in our clinic, we do ask about the need for food, the unemployment. The one thing that I think is critical in our community is because the mainstream culture is more direct. And in the mainstream culture, not the Latino culture, if somebody needs something, they will tell you, we're struggling, we don't have food. But for some reason, and I make a big emphasis, and this is something that we all should share with our community members, there is no shame about asking for help. There is no shame about recognizing that we're struggling, that we need help. So it's very important that we are proactive and we as families, and this, you don't have to be a provider or a professional to ask for this, but talk to your friends, talk to your community members and ask them, are you doing okay? Do you have enough food? Do you have enough, everybody has a job? Because people sometimes feel for some reason, and this is very inherent to our culture, that it's kind of embarrassing. It is a shame if I have to ask for help. It is a shame if I have to recognize that I lost my job. It is a shame if I have to recognize that we don't have enough food. So let's all be proactive, ask our community members if they're doing okay, and offer concrete solutions. And I gave some of this in the PowerPoint presentation, some of the resources, Casa San Jose, the food bank, etc. So yeah, let's be proactive and let's ask. And it can be as casual, and the other way to make it less direct, you can actually put on yourself, actually at home right now, somebody lost a job. We might not be earning as much as we used to earn 3 months ago. It hasn't been that easy. It hasn't been that easy to go to the supermarket. Are you having any problems like that? Are you experiencing anything like that? And that might start a conversation where people feel more comfortable about sharing. And obviously, we know that information, we should be able to help more other members in our community.
Great. There's another question from Greg Yost, and I will read it literally as he wrote it, so that you might think about it. So is there any evidence that racial or ethnic matters that are not socially determinative, of a non-social determinative nature, are at play in the corona crisis? In other words, for example, as Europeans are more, European descendants tend to be more prone to skin cancers when socioeconomic situations are factored out. Do any populations show any greater or lesser likelihood of infection independent of socioeconomic determinants of health?
That is a really good question. And the truth is that we don't know. We just don't know. I guess there might be some genetic factors. We don't know that. There could be some genetic factors who protect some people and make more vulnerable other people. We know age is one of the determinants. So younger people tend to do better. I mentioned the other ones that we know. But in all honesty, the truth is that if anything COVID has taught us is that we have to be humble because there is so many things that we don't know and things change on a daily basis. So even if I had some information today that I could share with you guys, it might not be true or relevant by tomorrow. So things are changing. I think it's a really good question and it's a really good aspect. If in fact there is some biological genetic determinants that predispose a segment of the population, my thinking is that they're not going to be alone. So the things that we show, they're clear for infectious disease. So when you have more social contacting, when you tend to share or have more members of the same family in the same room, when you have to have these jobs that are high exposure, you're more prone. So they are definitely there. I don't think those are going to change in the future. Things that are not going to change are basic things such as washing hands, social distancing, using a mask. That's not going to change. But yeah, do we know whether on top of that there might be some genetic or biological factors? The truth that we don't know, and studies in the future will tell us that. And it will tell us as well how we respond for treatment and vaccines, etc. So I think it's a really good question, and it's something that we will be learning over the next couple of months, over the next couple of years.
Great. And I should say, and there's not necessarily a plug for us. On the contrary, there's a plug for the businesses that we have been trying to amplify the channel for since March. We've had this listing in our newsletter that we publish every week for businesses that you can support that are associated with the Center for Latin American Studies, primarily the festival, but also some that we are affiliated with. And so, if you want a short list, or I promise we get nothing from it more than supporting those of us who are in our community.
Yeah,
But
we
check
know
it on
that
our
the
page.
big change business, big restaurants, they probably going to survive. But we're really worried about the small businesses. And yes, the Center for Latin American Studies is a great resource. I will encourage you to visit their website and visit all the resources that they have available, because yes, they do have a list of businesses that everybody can support. So I highly encourage everybody to think about those businesses.
Okay, and there's a question from Marty. In terms of advocacy, what is needed most in your opinion, Diego?
So I gave some points on some ideas of things that you can do practical. I hope many of you or everybody who could vote yesterday voted yesterday. And of course, we want everybody to vote in November. So please vote. Vote is one of the most important things that we can do. If you're a citizen, you can vote. Please vote in November. Second thing, make sure you answer the census. The census is really important because knowing how many we are, that's a way that we make ourselves less invisible. If you have the opportunity, if you see there are some emails circulating about how to support this Dream Care, which is the idea to support, to ask our legislature to support universal healthcare for everybody, that would be another idea. There are many ways that advocacy is being done at the local, at the regional, at the state level. Casa San Jose is also very involved, the Latino Family Center, the Latino Community Center. So, the more that we can make our community less invisible, more visible to the eyes of everybody, the more that we have a voice, the better that we're gonna do. And so some just ideas, I'm pretty sure there are many more, but some thoughts and some things that are easy to do, just answer the census, vote, those kind of things. Thank you so much, Manuel. I would like to end probably to thanking again the Center for Latin American Studies for what you guys do. When I was showing that slide that we tend to be a community that don't live in the same neighborhood or in the same barrio, we do find ways that we get together and that are central. So churches sometimes are one of them. Class, Center for Latin American Studies for sure is one of them. Probably one of the biggest gatherings that we have for Latinos in the city, in the region, it's the festival. And we're looking forward, and we don't know what is going to happen. Hopefully we can do it, but we're looking forward for future festivals. If it doesn't happen this year in September, probably will happen next year. He has been around for, if I remember correctly, 45 years. So I want to thank class, the faculty, the students for all what you do, the staff, Luis, Luz, Jessica, everybody who is part of class, because you guys are a tremendous presence in the community and you do a lot for the community. And again, I want to encourage everybody to think about our friends, our families, our neighbors. I want to encourage everybody to ask, to share stories. It doesn't have to be public, but, talk to your friends and ask them, are you guys doing okay? If you have some struggles, share the struggles with them, because that might make them more humble about sharing their own struggles. And again, I want to emphasize, please, there is no shame about asking for help. We as Latinos, we tend to keep our face and sometimes don't ask for help. I always tell the story that when I was growing up, my mom told me that if you wanted to be a polite Latino, you don't say yes right away, and you don't ask for things. You wait until things are offered to you, and you only say yes after the third or fourth time. And while that might be very nice and might be polite, it might be not practical in times of crisis like this. So let's make sure that everybody gets the help that they need, that everybody's helping everybody. We are all together in this. And I cannot emphasize more on that. And, hopefully everybody's going to be healthy. I want to wish everybody's families, your families here in Pittsburgh, your families here in Southwestern Pennsylvania, your families here back in Latin America. I want to wish everybody to be healthy and safe. I'm going to keep you, I have a big belief in God, so I'm going to keep everybody in my prayers and wishing everybody to be fine. And it seems that at least here in Pittsburgh and Allegheny County, we're moving in the right direction. And hopefully that's the same for the entire world, because we're not going to survive this. We're not going to go through this alone. We're together on this, and we cannot leave anybody behind.
Thank you, Diego. And in fact, yes, let me reiterate, the center is here for any connection that you think that we might be able to make, anything, any resource that you think that we might have at your disposal. Anything that we have that we can do, we will try very hard to do. And if not, try to connect you to somebody or a group or an institution that might be able to help you better than we can. So that's one of our big functions, and one of the things that we're most proud of, that we try and connect the community. Thank you very much for joining us. We appreciate it. As I said, the recording will be made available, and just once again, Diego, thank you very much.
Thank you, Manuel. Thank you, everybody, for listening. Please stay safe and stay healthy. Thank you.